They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. Today, we connect with thoracic ENT and surgical nurse Vanessa Large. Vanessa, good morning. Thanks for joining us.
Thank you.
Tell me a little bit about your role, because I understand you were a very critical component to the switch when COVID came to be 10 months ago and the hospital had to put all hands on deck. Your role in what you do as a nurse was critical.
Usually I've been a surgical nurse with the ENT and thoracics team. And last year in March, our unit was transformed into the COVID unit. And we've been working as that ever since. So it's been an adjustment, trying to change roles and figuring out where our place is and working through the pandemic.
What is it like for you working on the COVID ward?
Definitely challenging and overwhelming most days. Unfortunately, we see a lot of trauma in terms of more emotional and mental based, with our patients being isolated and away from their families. And we're also away from our families and isolated. So it's been an emotional adjustment to try and cope with the work stresses and our personal life stretches.
I understand you are engaged to be married to a paramedic, so you've had to isolate.
Yeah, we unfortunately, our wedding, like most couples of 2020, got postponed. And both being in healthcare, we unfortunately haven't seen much of each other throughout the pandemic, and have isolated ourselves from our families just to keep everyone safe. And if we ever had an exposure, we had to isolate from each other in our own house. So it made a bit of a challenge, working through everything while living with another frontline worker.
Wow. What's been the biggest challenge for you at work? What is there a moment or a day that you'll just never forget?
There's definitely a day I won't forget. We unfortunately, working through the pandemic, a lot of our patients have needed airborne rooms, and unfortunately, there's just not enough to go around. So we were using private rooms and closing doors to make it safer for the patients and for us. And being stuck behind those doors if a patient's not doing well, being one-on-one with them while you're talking through a baby monitor to a team outside the room for about 4 hours until we decide a plan whether it's ICU or not, is exhausting while wearing all your PPE the whole shift. So it takes a toll on your body and your mental capacity after that when your patient's only staring at you and wondering what's going on.
Yeah. And you end up becoming not only their healthcare worker, but I would imagine in some way their support network too, because family members can't be there with them, right? Do you feel like there's an extra layer of pressure on you to be there for your patients in that capacity too?
Yeah, for sure. Our patients were here, especially at the beginning, for so long, as when we were learning how the COVID worked in general. And the patients that were here for a long time, you got to know them very well, and you were their only source of contact. And vice versa, they were your source of contact other than your colleagues, to get you through the day. So you eventually did make quite a bond, which made it very difficult if they weren't doing well.
Where is your head at in terms of where we are in this pandemic? Do you feel hopeful or drained? I mean, what do you feel when you wake up in the morning and you have to go about your life in the middle of this?
Honestly, exhausted would be the best answer I could give, but I am hopeful. News of the vaccine coming to Ottawa and starting to make its rounds is great. If it would be better if people could follow the Ottawa Public Health guidelines a bit better. We're doing our work here so that we could keep everyone safe. And if people in the community could follow the guidelines set out, I know they're not fun, but they do really make a difference. And that would help everyone get this a bit more controlled faster so we could do more in the end.
Yeah, and that's just it, right? I mean, what we do out in the community directly impacts you in your line of work and what you're allowed to do. Does it get a little frustrating when you see the numbers go up and you think, it's not that hard, stay home?
It is a little frustrating, especially being a frontline worker who's been in the depths of it since the beginning. Since I've had to isolate from my family and my friends, it's frustrating when you see people on social media still going out, doing activities, and you're on both ends working through the pandemic personally and professionally. So it does make it a bit frustrating, but hopefully the numbers have slowly started to go down, and hopefully everyone can just stick in it a little bit longer and we can get things a bit more opened up while maintaining the guidelines would be great.
Vanessa, thank you for all you are doing for our city right now. I can't imagine the stress that you have in your life, but it is not lost on us. We appreciate you and everything you're doing as a nurse on the COVID-19 ward at the Ottawa Hospital. I don't know where we'd be without the good people like you. Thank you, Vanessa.
Thank you very much.